So it's 12 noon here in sunny and hot and steamy on fire, California. Good afternoon, everyone, and welcome to the California Black Health Network session on Your Health, Your Vote, a dynamic panel discussion focused on protecting our health, our healthcare, and our lives. Before we begin, I'd like to go over a few housekeeping items. First, please make sure you stay on mute, unlike we just did. Also, you may want to switch your view to gallery mode if you haven't done so already. You will also have the opportunity to ask questions later during the Q&A, although you are welcome to submit your questions in the Q&A box at any time before or during that portion of the program. So what's in store for us today? Well, I'll start with a brief introduction and share why we are here today. And then I'll introduce the panel speakers, who each will give about a 15-minute talk and share their perspective on the topic. Then I'll pose a few questions to the panelists and then open it up to the audience for your questions after that. So, okay, next slide. I am Rhonda Smith, the Interim Executive Director for the California Black Health Network, and I am honored to be in the company of three amazing and very accomplished individuals who work hard every day to keep African Americans and other communities of color across California healthy and well and strive to achieve health equity for all. So our speakers today are Jamal Miller, Vice President, Equity and Inclusion, Office of Diversity, Inclusion, Equity and Belonging at Common Spirit Health, Dr. Valerie Yerger, Professor of Health Policy, Social Behavioral Sciences at University of California, San Francisco, Dr. James Kyle, Medical Director for Quality Improvement at LA Care Health Plan. So why are we here today? Well, as we all know, we are experiencing unprecedented times from a health perspective, a political perspective, and from a racial and social justice perspective. So we're here to really talk about this and hopefully educate, encourage, and empower all of us to take action regarding our health, our healthcare, and our future. We'll talk about what is at stake regarding our healthcare in the upcoming election and what we can all do to protect that and our health overall. We'll talk about things from a national as well as a statewide perspective with regard to protections, policies, and actions regarding the Affordable Care Act and pre-existing conditions, the impact of COVID-19 on all of that, and address social and political determinants of health within the Black community. So let's get started. Our first speaker is Dr. Valerie Yerger. Dr. Yerger is a licensed naturopathic doctor and professor of health policy at the University of California, San Francisco, and a former health disparity scholar of the National Institutes of Health. The overarching goal of Dr. Yerger's work is to frame the disproportionate burden of tobacco among marginalized communities as a social injustice and to inform public health policies so that they effectively reach and engage these communities. She's called out big tobacco on their deceptive marketing tactics and disproportionate marketing of menthol cigarettes in inner city communities and the use of menthol as an additive in cigarettes. She has built an incredible legacy through her educational and advocacy efforts to restrict the sale of menthol cigarettes and other flavored tobacco products in the Black community. Dr. Yerger has provided expert testimony to the U.S. Food and Drug Administration and its Product Scientific Advisory Committee, just another example of her impact. She has received numerous awards and recognition for her work. Without further ado, let's welcome Dr. Valerie Yerger.
Wonderful. Thank you for the opportunity, Rhonda, to come and speak to this incredible audience. I'm right now just wanting to get my slides and making sure I'm not on mute. So hello, everyone. So at first, I was wondering if I would have anything to add to this discussion, and then I realized how crazy a question that was for me to ask. Of course, I have something to add, and I'll be bringing, I hope, a perspective that you're not necessarily going to hear anywhere else, given the unique nature of my background as a naturopathic doctor, a tobacco documents researcher at UC San Francisco, and someone who has very recently just gotten involved in the whole policy world and political engagement, not so recently, the past 20 years or so. So I have a few minutes, and I'm going to try to provide an overarching discussion about the relationship between what I think are pre-existing conditions that may in fact affect our political engagement. I'll spend a few minutes talking about tobacco, the effects of COVID-19 on our population, and the role of racism. So many of you probably are quite aware that tobacco-related disease and death disproportionately burden communities of color, especially African Americans. Among those who are living below the poverty line, our smoking rates are twice as much as the general population. Among African American men, we see a disproportionate rate of lung cancer, not only in terms of incidence, but also in terms of mortality rates. And we know that alongside of our population, there are disproportionate effects of tobacco on American Indians and Latinos and other what we call priority populations here for the state of California. And not only are we dealing with smoking rates, but we're also dealing with exposure to secondhand smoke. And now we know about thirdhand smoke. And we also know that our communities are disproportionately burdened by the presence of the tobacco industry. So given that we're now dealing with COVID-19, even if we're not even thinking about tobacco and we pull that out of the picture, we still see disproportionate rates of COVID-19 affecting Black Americans. Unfortunately, because so many of us are also dealing with tobacco, we are also dealing with disproportionate rates of COVID-19 in terms of disease, but also in terms of death. And again, this is something that we see happening not only among African Americans, but other communities of color. So Blacks and Latinos and Americans who are living with what we see are pre-existing conditions, we get kind of sort of focused on the pre-existing conditions, and we do want to recognize that these pre-existing conditions do play a role. However, many of our individuals who are living in communities of color are essential workers, and they're the ones who have the frontline jobs that keep them from working at home. They have to rely also on public transportation, and unfortunately, many of them live in cramped apartments or live with multi-generational situations. So it's kind of impossible to quarantine, let alone isolate after you've been diagnosed, if you have to share the same bathroom or you live in very tight quarters. So when it comes right down to it, it's not that because we are people of color that we are naturally more likely to develop these conditions or to respond in the way that we've been responding to COVID-19. It's more because of the fact that we're dealing with so many of what we know as the social determinants of health, and we're subjected to these hardships much more so than whites. When it comes to looking at the children and teens who have been affected by COVID-19, we know that though the numbers are relatively small compared to adults, almost all of the kids and teens who have died from COVID-19 have been either Latino or Black. In addition to the health issues that we see with COVID-19, we also recognize that the effect of the COVID-19 recession disproportionately has a burden on us. And I show this is results from a report that was out of the Brookings Institute, and this is before COVID-19. So we see that solid blue teal line represents our net worth among African Americans. So you take all of this and you put it together, and it's like, no wonder we're having some of the issues that we're having today. So race, as I want to point out, is not the reason African Americans are having a higher risk from dying from COVID-19. It is because of racism. So systemic racism just doesn't show its ugly head in the criminal justice system. It's something that we see. And as a naturopathic doctor, I'm quite aware of racism as a stressor. As I know many of us, as we think about this, it helps us to understand why we see some of the disproportionate rates on physical health and others because of the amount of stress, whether we're just looking at it in terms of racism, or if we just recognize the fact that because of racism, we're dealing with all these other economic, social disparities that have an impact on us. I guess I sort of got rid of one piece of this slide. That's okay. But as a result of just living with these stressors, we are constantly in a fight or flight response. And I think that, I would personally like to hear us providing a little bit more attention to this, because if we are dealing with these acute issues that turn into very chronic issues because we don't get a break, we are in fact secreting stress hormones, including cortisol. And this has a direct effect on how it is that we just show up in the world and how it is that we relate to individuals around us. Even if we're in a situation where we're comfortable with family members, or we think that we're in love with them, if we're in this constant fight, flight response, we're in a survival mode. And being in a survival mode puts us in a place where we aren't very, we don't collaborate, we're not creative. Those of us who are on this webinar know very well from our own personal experiences, whether we are in a stress mode ourselves or we're around people and we recognize when they're in a stress mode, there are times when you just don't want to communicate with individuals because it's not a place and you're not going to get any results. So you know that if people are being unreasonable because of the amount of stress, that there has to be something that needs to be done to move them out of that space just so that we can communicate. So if we're constantly secreting cortisol, it has a direct effect on our physiology and also in terms of our mental state as well. And these are just a few of the physiological results of having cortisol just constantly flowing through our bodies. And we're looking for ways to cope. And this is why it's important in the work that I'm doing around tobacco to just recognize that we have to deal with the demand and not just the supply issues related to this epidemic of smoking. But the one thing that I also want to share about this is that we have impaired immune system when we are under the effects of cortisol, and when we get exposed to something like the coronavirus. Of course, we're going to have a very specific response to that because we're not going to be in a position to be able to deal with it. I also want to just point out this book, The Political Determinants of Health, because for those of us who've been working in public health, we know the importance of recognizing the role of the social determinants of health. But in this book, Daniel Dawes argues that the political determinants of health really create the social drivers, the poor environmental conditions, the inadequate transportation, unsafe neighborhoods, and the list just goes on and on, all of which contribute to the many health disparities that we see. So the political process isn't really just about choosing who is going to be our next president, but it really calls to how do we have an effect on the political processes that are happening at the local level. So I wanted to just take just a few minutes. I think I have about 3 minutes left, to talk about how those of us who have been working in tobacco control have really come to appreciate the power of Blackness, also in terms of waking up the community. And I wanted to just share some of the lessons that we learned. As a tobacco documents researcher, I have been revealing the tobacco industry's presence in our communities using their own words to help wake up and educate our community. So when we go in and we talk about tobacco, we have to make it relevant to communities that are dealing with a lot of other acute issues. One of the things that we know is just how the tobacco industry feels about especially our African-American young men, and see them as trendsetters. And this was very, very important in terms of making menthol cigarettes as big a product and as big a piece of the overall tobacco market as it is now, because they focus so heavily on targeting this demographics during the 70s and 80s. And sure enough, we're seeing young white kids and young kids of other racial and ethnic groups that are starting with menthol cigarettes. The other thing that was uncovered in my research was the fact that nicotine accumulates in tissues containing melanin. This is something that the tobacco industry has known since the 50s, but they have never taken the time to educate us about that. Not any of the times that they've sat and broken bread with us, as they've sponsored so many of our conference luncheons and just providing funding to our community groups. They don't disclose this. I think that it's important, if we're going to be talking about power, that we understand how important melanin is, and we get it intrinsically. What I like to point out is that melanin is something that is heavily studied. There are billions of dollars of research that's going in to understanding melanin, and we might see reference to pigment. That's what they're talking about, melanin. And here we have it intrinsically. And I also like to point out that there are large research societies that are totally focused on melanin. We've got Asian Society, the Japanese Society, the Pan American Society, the European Society. All of this is to understand how they can create it. And I think that it's important for us to understand this in terms of educating our kids and letting them know just how super powerful we are. I also want to just end very quickly giving an example. The African American Tobacco Control Leadership Council is a group that I helped to found. Worked very closely with Carol Magruder and Dr. Phil Gardner, who are the co-chairs. And we went the route of trying to make change at the local level. After years of trying to get something to happen at the federal level, we did our focus at the local level, starting in San Francisco with the comprehensive ban. Now, we've been doing a lot of work, but I don't have time to go into the history of our work. My point is that the biggest comprehensive flavor ban that included menthol cigarettes happened in San Francisco. And we had to take it to the voters because of interference with the tobacco industry, but we won when we went to the ballot. And again, this was in 2018. As a result of us having this huge impact locally, now in the state of California, there are over 70 jurisdictions that have a bill ordinance that has resulted in the ban of menthol cigarettes and other flavored tobacco products. When we went local, we were able to go statewide. SB 793 was recently signed into law by Governor Newsom. Of course, right now the industry is trying to stop this. I will quickly say, if you see a petitioner asking you to sign the petition, please understand, even though they may tell you that the petition is to save the law, it is not. And just understand there are tactics that are being done by the tobacco industry to confuse our people. So I will end this with recognizing the fact that, hey, a lot of us are out there voting. We're doing it. We're making it happen. These are some resources that were provided to me through my sorority. And I just want to say to all of us, let's do what we need to do. If you haven't voted yet, get your ballot in and do so by November 3rd, and then just to redirect our efforts to local. All right, so thank you, and I will give it back to you, Rhonda.
Yes, thank you, Dr. Yerger, for that amazing presentation and information. And hopefully what you shared is new news to most of us. I know it was for me, so thank you for that and educating us on those issues. And so the next speaker up is Dr. James Kyle. Dr. Kyle is the medical director for quality improvement at LA Care Health Plan, where he oversees HEDIS and accreditation and quality performance measurements and management functions. Dr. Kyle works to ensure that he and his staff are doing all that they can to keep their members healthy, whether it's through personal phone calls to high-risk members, ensuring that their needs are met, or medication, food, or emotional support. He works together with leaders in all facets of healthcare in the LA County area to develop strategies to prevent further spread of COVID-19 among vulnerable populations. So thank you, Dr. Kyle, for all that you do to keep our people healthy. And with that, I'll turn it over to Dr. Kyle.
Thanks, Rhonda. Thank you very much. It's good to be here with you today. I'm on vacation, but I felt this conversation was too important not to engage in. And so I decided to take a break in my vacation just to make sure I could talk with you. I wanted to kind of talk about the political climate as well as what's going on in locally in terms of healthcare. We recognize that there's been a new Supreme Court justice that's been added who possibly, based on her previous writings, will rule against the ACA when that comes up next month at the Supreme Court. I want to tell you a bit about the impact of the loss of the ACA. For LA Care, we have 2.2 million members that we care for. We are the largest Medicaid health plan, public health plan in the country. We have a very, very vulnerable population of people that we care for in LA County area. If the ACA is somehow done away with and not replaced immediately with something as good or better, then we will lose about 800,000 members will lose their coverage. 800,000 people thrown out of healthcare overnight. And that will dramatically impact not only LA Care, but every Medicaid health plan in the nation will feel the impact of that. So we're talking about millions of people who will be disenfranchised from healthcare. And that's a big issue. The importance of this election, therefore, cannot be minimized. This election will probably determine the future of healthcare and healthcare access for the next 4 to 8 years, and perhaps longer in our country. And so many people can lose coverage depending on who's backing this healthcare. In fact, even if the Democrats prevail during the lame duck session, and depending on what the Supreme Court says, we could still lose the ACA, which will have to be then redone and reconstituted. So the question that I see for our patients and for our community is really a question of equity and justice, racial justice. We view structural racism as a public health emergency. And it's interesting to use the term emergency because it's been going on for long as we've been in this country. But it is emergent in terms of its impact, in terms of this continual assault on our communities. And it makes it very, very difficult for people to live when they're dealing with, as Dr. Yerger was talking about, with the catecholamines and the other processes that happen as a result of living with stress and stressors. We have been focusing on the whole question of equity. I also, for our health plan, besides being in quality, I lead out in our diversity, equity, and inclusion efforts for our health plan. We've scheduled already 2 summit meetings, and we're working on another with LA versus hate, which we're cooperating with other groups around how we dispel hate and hate crimes in our community. But when I look at our community, what I recognize that we have to now start thinking about what happens after the election, what happens post-COVID, assuming that we should survive it. How do we prepare ourselves to not be as vulnerable as we have been? Well, all of the disparities that we talk about and we've been talking about for years, I'm convinced if we keep doing what we've done in order to try to eliminate health disparities, we'll always get what we've got, which is they'll still be here. What we really need to start focusing on is not just hypertension or just diabetes control or asthma control. We need to start focusing on those things that really matter in the long run to people's overall health. And that is getting people access to full care, getting people jobs, getting people safe housing. And that to me is the new public health agenda for us. It's not just focusing on disease. It's going upstream to causation and to the things that are mitigating against a healthy community. My dad died when I was 10 years old. He was a menthol cigarette smoker. And in my community in South Central LA, the only thing more ubiquitous than churches are liquor stores. And that's where you can buy all your tobacco products and everything else you want to buy. Yet when I go across town to other parts of Los Angeles, I don't see the advertisements on the billboards. Something as simple as saying, we're going to take these billboards out of our communities. The food deserts that we live with on a regular basis, that's a health challenge for minority communities when people cannot get access to food. And I would suggest to you, and I'm sure Dr. Yerger would agree, that if we want to live longer, we've got to start eating better. We've got to eat wholesome food and see food and nourishment as medicine and to protect ourselves. And not everything that's good to us is good for us. So when you have a choice, you ought to choose, probably nutrition dense rather than calorie dense food, nutrient dense foods, and basically foods as grown, as in vegetables and fruits and nuts and other kind of things. If your food had a face, then it's probably not going to be the healthiest thing for you to eat. Now, I know that's anathema in many of our communities. Am I anti-chicken and steak? Yeah, I am, because those are the things that are leading to our early demise. Am I pushing for us to be on a plant-based diet? Yeah, because the research is just too compelling that people who are on a plant-based diet live longer. And until we develop the courage to start saying that to people and tell them to take the kernel and put it away for a minute, take those burgers and put them away and return to a plant-based diet, we're going to continue to have these kind of disparities running rampant in our community. I see structural racism, therefore, as impacting us around COVID. We wouldn't be in the condition we are in had it not been for the structures that placed us at high risk. In one of our summits, Dr. Carlisle, who is the president of Charles Drew University, made a comment about underserved communities. And it was a compelling comment, because what he was really saying is, it's not that we have communities that are underserved, we have communities that are under-resourced. And there are enough indigenous community organizations that can serve our communities well. They don't have the resource to do so. And so at LA Care, we're trying to look at how we picked out this year about 6 community-based organizations that we're going to be plowing millions into to help them to become more efficient, more comprehensive in their approach, and more effective. One of the things we're looking at in terms of healthcare and health plans is we can match all of the NCQA and all the other kind of measures, state measures around being a great health plan. The question is, are we an effective health plan? And what I mean by this is, can our industry effectively improve the health status of millions? And it's one thing to get accolades from the National Quality Assurance people. It's nothing to be effective at actually changing anything. So what I'm tired of is I'm tired of seeing us incrementally improve these little measures about how many people are taking their asthma controllers, or how many people are doing this or that. And yet at the end of the day, nothing has actually changed for the quality of life for kids in our communities. Access to education, access to transportation, access to good jobs. None of that has actually changed. I believe that's got to become part of the work of health plans. If we're going to make our communities healthier, we can't be just, trying to improve people's blood pressure. Yes, that's important, and we will continue to do that. But we got to look at the things that are making that blood pressure uncontrolled and higher than it needs to be. So I want to conclude by saying that I believe that we've got to change the agenda. This election is too important. We've got to vote. We got to get our vote out. But the life is going to go on after November 3. What is our strategy and our plan as a community? And I believe that we have to have broad coalitions that are multifactorial: healthcare, business, education, all working together to try to figure out how do we improve the safety net, which is not something that's just healthcare organizations, but the safety net in society. And I think when that kind of conversation can go on, I think the better off we'll be. So I'll reserve that for questions later, but thank you for the opportunity just to share from my heart.
So thank you so much, Dr. Kyle. And you're absolutely right. We've been talking about health disparities for decades, and there's been lots of resources and funding invested in whether it's research or doing community-based initiatives, and we're still talking about health disparities. And like you, I'm sick and tired of being sick and tired of talking about that and nothing changes, or just seeing incremental changes. So to your point, unless we deal with some of the structural reasons why and the causational factors that contribute to health disparities, we're going to continue to have this conversation and not see the significant change or shift that we really need to see to achieve better outcomes and health equity for all. Yeah. So with that, I'd like to introduce our next speaker, definitely last but not least. He's Jamal Miller. He is otherwise known as the Ebony Genius. He is the Vice President of CommonSpirit's Office of Health, of Diversity, Inclusion, Equity, and Belonging, and he's responsible for equity and inclusion initiatives. Prior to joining CommonSpirit, Jamal served as the Director of Corporate Reputation and Thought Leadership at Blue Shield of California. Earlier in his career, he spent time at Kaiser Permanente and Sutter Health. Jamal's experience is steeped in health equity, and he is recognized as a national thought leader and expert on issues pertaining to healthcare, public health, health equity, mental health, and public policy. He was appointed by Governor Jerry Brown in 2013 to serve as the Deputy Director of the California Department of Public Health Office of Health Equity. In that role, Jamal was the state's lead advisor on issues related to reducing health and mental health disparities and achieving health equity for all Californians. In the interest of time, I won't go into all the details of his background and experience, but Jamal is quite accomplished in his young years and has rightly earned the place as the Ebony Genius. So I will turn it over to Jamal.
Thank you so much, Rhonda, and good afternoon to everyone on the call. It's good to see some familiar names and definitely some familiar faces, and great to virtually meet some of our new colleagues and friends who are on the line. I think the topic of our health, our vote is so important in that there is an inextricable link to our health when it comes to how we vote, why we vote, when we vote, and ultimately whether or not we exercise that franchise to the extent that it is being disenfranchised and has been for years. So this topic is extremely important to me. And just a quick background on my current role as System Vice President of Equity and Inclusion at CommonSpirit Health. I lead our national health equity strategy. CommonSpirit Health was created as a result of a merger between Dignity Health and Catholic Health Initiatives in February of 2019. And in October of 2019 is when I joined the organization. Across those 21 states where we have over 140 hospitals, over 1,000 care centers or ambulatory clinics across the country. And our focus, when we think about our mission, is really committed to social justice and addressing the needs of the most vulnerable. And within the context of that mission, it really makes the work of strategically leading our health equity practice much easier in that we hold it as a top priority. and our Office of Diversity, Inclusion, Equity, and Belonging reports directly into the office of our CEO, Lloyd Dean, who has been very open and supportive, and professionally and personally has a strong passion and commitment to health equity and Common Spirit Health, being a leader in this space. So with that said, I am grateful to just for probably about 10 years now to have in some way, shape, or form in my professional career interacted with, and supported the California Black Health Network. I think the organization overall is extremely important, has such power in convening forums like this. But I also think moving forward with regard to advocacy, public policy, and affecting real sustainable change, the importance of supporting the network and the staff and many others who are affiliated is extremely important. So I just wanted to acknowledge that as well when we think about kind of my theme over these next couple of moments before we open it up on why the power of political incorporation and civic engagement is so important. One of the lesser known quotations of Dr. King, which is my favorite quotation that I've been using a lot lately, is this, what you see on your screen. And this is a quotation that he made in April of 1967, April 4th, at Stanford University, where he says, "Morality cannot be legislated, but behavior can be regulated. Judicial decrees may not change the heart, but they can restrain the heartless." So I'll let that rest with you for a bit as we are in this important election cycle and in this election season. But when we think about the value of political incorporation and civic engagement, it has to be ongoing. It has to be sustainable. It has to be perpetual. And it can't just be during the generals or even just the primaries. There are ways for us, especially within our community, particularly Black, Indigenous, people of color, when we think about the disparate impact that both clinical and non-clinical conditions have had on our community, I contend that there was a direct correlation to how our community has been disenfranchised with regard to political incorporation and civic engagement. And in this season of pandemic, and also being reminded of the persistent presence of racism and oppression, we have a great moment and opportunity before us to galvanize ourselves and to place into motion what it is that Dr. King talked about here, in that we can make a very compelling moral and ethical case. We can pull at the heartstrings of those in power, but the language of our country, and particularly Western societies, is that of policy, is that of economics, and those two equate to real power and enfranchisement. So if we want to get things done, you know, to the extent that diversity, inclusion, equity are no longer just marginalized, exceptional experiments that we engage in, but making those core to everything that we do, we have to pull those levers from the standpoint of voting, of political incorporation, civic engagement, and building that internal capacity within our own community. And what you will find is naturally there's a positive correlation from that to enhance life expectancy, enhance quality of life, so on and so forth. So that's why I'm so passionate and excited about today's topic, and also highlighting having been practically in a role in the Brown administration, as was shared earlier, leading California's Office of Health Equity, being a gubernatorial appointee confirmed by the Senate. Our team would do extensive legislative and bill analyses, engaged in kind of the sausage making process. We had $60 million in Mental Health Services Act funding from Prop 63. Once again, that was voter approved. I was able to practically see in that leadership position in government, when we are in those roles, when we think about the value of appointments to boards, commissions, executive appointments to carry forth democratic and progressive policies, it makes a huge difference. So that practical experience is something that I was able to garner and I carry with me to this day, and try to use every opportunity that I have to convey the importance of our broad and deep engagement in the political process. When you look at candidates that you want to consider, which of the candidates is going to be able to advance policies and appoint executives to carry out programs and budgets that have and personnel management decisions that have social services implications, health and human services implications, criminal justice reform implications, air quality, water quality, so on and so forth. That's beyond just the candidate. But you also think about, will that candidate bring along those who look like me, who may think like me, who may represent the greater interests of our community? So there's a lot to unpack from this short quotation, but that's why I wanted to use it to just set the tone for my brief comments today. I love to revisit this study to put a different spin on Black Lives Matter. The study a few years ago was led by Dr. Javier Rodriguez. And everything that Drs. Kyle and Dr. Yerger mentioned earlier is extremely important. And what I like about what they said that leads into highlighting this white paper is really, we can look in this paper at the cumulative effect across generations of premature death or health inequity within Black communities, in particular in the United States. What this study did was look at the cumulative impact politically on the Black electorate on the 2004 election. So when John Kerry and George Bush were competing to be the president of the United States. This study highlights premature death from 1970 to 2004 was estimated at roughly 1.9 million African-American men, women, boys, and girls who died prematurely due to health disparities in our country. Based on voting trends and voting age eligibility in 2004, roughly 1.7 million of those people would have been at voting age in 2004. Based on political trends and voting patterns, George Bush would have gotten 100,000 more votes in the 2004 election from the Black community. John Kerry would have gotten 900,000 more votes from the Black community in 2004 if they had been alive and exercising their franchise by way of voting. 7 gubernatorial races would have been flipped from a Democratic candidate or from a Republican candidate to a Democratic candidate. 11 state Senate races would have been flipped from a Republican candidate to a Democratic state senatorial candidate. So when you think about voter suppression, in addition to long lines and holding up the mail service and voter ID, laws and things of that nature, health disparities very much so is a different type of voter suppression. So if you think about what repeal Obamacare means within the context of this study, or if you think about, we're rounding the bend on COVID-19 because the status quo is seemingly okay, but Latinx, Black, Indigenous people are dying at disproportionate rates. That status quo politically benefits a certain political affiliation. So as Dr. Yerger talked about, this political determinants of health piece that that Daniel Dawes, who's a good friend of mine, I just texted him a screenshot of Dr. Yerger's presentation. It's real when we think about, we know the social and the economic and the environmental kind of determinants of health and equity, but that political determinants of equity is extremely important, because when we elect people, when we look at across the decades of representation here of the racial makeup of the US Senate, the big light shaded area, that's pretty much majority, showing you that it's been white male senators from pretty much throughout the history of Congress and the Senate. And then it starts to diversify a little bit over time. This is not and has not been the browning and the tanning of America as we know it. So there's something off as far as political incorporation, civic engagement that leads to representation on our behalf for our interest. Same goes for the House. It's a little bit more diverse and inclusive, but it's a similar dynamic. That big block of white and others, primarily white men over time, who have represented our interests, if you will, or not so much. And this is extremely important because there's that direct connection from doing something as simple but yet as powerful as voting, but also showing up at legislative hearings, showing up at urban planning councils and having your voice heard and engaging across that continuum of the political process and not waiting until it's too late, you know, when the money is already going to go out because those decisions have been made a long time ago, but we get engaged in the process way downstream when it's too late. And that could be where they're going to build a new road, you know, through our community, where you have a higher, you know, air particulate when we think about air quality and higher traffic and commuting through some of our neighborhoods. There are a number of examples that I can use, but once again, making that direct connection to those who are to represent us at city, county, state, and federal levels, because they make huge budgetary and legislative decisions when we think about the social determinants of health across economics, environmental decisions, so on and so forth, and the huge, you know, fiscal allocations and plans that are made that affect our everyday lives, our schools, so on and so forth. So I'll wrap up here just to contextualize really all of our entire conversation about how we make that connection from our health and our vote, and how we pivot from, you know, focusing solely on sick care, downstream oriented, volume driven care that has broken our healthcare system and has really created such inefficiencies that are very, very costly, because all we do is focus on mortality, disease, and injury. And by then it's it's downstream enough to where we're band-aiding at that time. We're only triaging versus focusing on how can we have a more upstream orientation in the public health framework on prevention, on primary care, to the great example that Dr. Kyle used around food insecurity in our communities, whether it's childhood obesity or people not being able to make healthy choices. Some of that may be personally driven for sure. And also if we go upstream, if we look at someone's living conditions, when we look at the institutional inequities and social inequities, sometimes it's not necessarily conducive to having, you know, better behavioral options, so on and so forth. So it all works hand in hand, but I would contend that when we think about the importance of political incorporation and civic engagement and how we change where we live, learn, work, play, and pray, we pivot and go upstream and look at how can we change the living conditions, those physical environments, the economic and work environment, service environment, social environment, as well as address the broader institutional and social inequities that we're far too familiar with. So I'll wrap up there. Thank you for the opportunity to share, and excited about our Q&A time together.
Great, Jamal. Can you switch? Can you change to host?
Absolutely.
Okay, thank you, Jamal, for unpacking that quote from Martin Luther King and really providing a different perspective on connecting our healthcare and our health and well-being with our power to vote. So that was very insightful and very helpful, and I learned a lot. I always learn a lot listening to you, so thank you for that. So before we move into our Q&A portion, I do have some questions for the speakers that I'd like to pose for some additional discussion. And so, you know, we've talked about things that are happening at the federal level, and we all know that there's a potential threat to our health insurance But I think Dr. Kyle, you kind of alluded to this, but what protections might there be here in California at the state level that could mitigate the impact of the Affordable Care Act going away? Any takers on that question?
Yeah, I'll jump in and we can let others join with me. I'm not sure that the protections that we actually would want are necessarily in place yet, but there's some active discussion about that. If we lose ACA, which means Medicaid coverage, already the state is suffering from the lack of a COVID recovery bill. We've already had dollars taken back from our health plan by the state. We have fewer dollars left to spend. We have a hiring freeze. These are some of the early things that are going to happen. If you lose ACA, hundreds of thousands of people in California will lose their coverage. So I think what we can try to advocate for here in California would be we've already done our Medicaid expansion. So if Medicaid is being cut back, then our expansion gets cut back at the same time. I think we're going to have to become temporarily, until government can come step to the table, we're going to become more self-sufficient. What I mean by that is we've got to find ways to stay healthy. We got to find ways to improve our health. We got to advocate in our own communities around the things that we know are mitigating against our health, to remove those elements from our neighborhoods. I don't think this is a pipe dream. I think it can be done when we take ownership of our neighborhoods and ownership of our institutions. We got to go back to our basics. We got to enlist our churches and enlist our other civic organizations to say, how do we stay healthy, and how do we doctor on one another? How do we support each other in that health? Because I think it's going to be a minute before we see, government riding in with a solution that's going to actually change anything for us. So if we just sit helplessly waiting on government to do something for us, I think we'll be in really bad shape at the other end of the spectrum. We got to start taking care of ourselves, and I wouldn't wait for that. I think we start today.
Yeah. Any other thoughts from the other speakers?
Yeah, I like to go next. I have a couple of things to add to what Dr. Kyle said. One of the reasons why I brought up melanin is because there's a reason why it's being studied. And one of the things that we know about it is that it's protective. And we get into trouble as African Americans because unfortunately we live in very toxic environments. And so our body is very busy trying to protect us from the toxins. But I think that if we understand just how powerful it is, that we're more likely to appreciate it and to help our children to understand the power of their color. One of the other things that I wanted to add as a naturopathic doctor is that it's important for us to also understand what it is that we're already doing. What are some of the tools that we have that we can incorporate more to help us deal with some of the challenges that we have. And within the Black community, the power of the church is very evident for many of us. What we may not understand and appreciate, and I've had a number of different discussions with some of our faith-based leaders, is that we as a people know prayer. Even if we didn't really participate in it, we know that we got through stuff because my grandmother was praying, my great-grandmother was praying. We know that power. And for those of us who do engage in it, we know how it is that we feel. So if we are in that state, in that meditative state, we are not secreting cortisol. And if we understand that we are giving ourselves a break during that time, we might appreciate the power of it a little bit more. So in addition to recognizing, how important food is, and I'd love for us to all have access to whole foods. I know what it's like to go into some communities and see Whole Foods, and I have a sense of whether the food has life in it still or not. We oftentimes don't even get healthy, fresh, so-called fresh vegetables. We get what's left over. So the more that we can engage in the process so that we can have an impact on what happens at the local level, there are some things that we can do now to help protect ourselves and to give us a break from the constant flow of cortisol and other stress hormones. When we're in that place where we're not so stressed out, we're much more likely to collaborate and to work with one another, because we as organisms are designed to keep the species perpetuated. And we can only do that if we are attractive to one another. And being in that state of stress and fight and flight keeps us from being able to make those connections. Otherwise, I don't trust you. I don't know why you're connecting with me. I'm not going to go into business with you because I'm in a survival mode. It's not about you, it's about me. And we've got to get out of that mode and teach our kids and our young people and even our old adults how important it is for us to use some of the tools that we already have, just so we can start, being able to make some real changes in our communities.
Oh, thank you, Dr. Yerger. Yes, being in constant survival mode does add a lot of stress to our lives on top of what we may already be dealing with, and subsequently or consequently impacts our health and well-being. So thank you for that. So Jamal, did you want to add anything to that question or discussion?
Sure. I'll add just as a continuation of what Dr. Kyle mentioned about becoming, more self-sufficient. I completely agree with that from an individual, perspective. And I also believe that from a statewide perspective, being, I don't know if it's the fourth, fifth, sixth now largest economy in the world, home to major carriers, major health systems, major employers. When we think about Silicon Valley, there are so many resources that we have in our state, to the extent that we come up with kind of self-sufficient solutions to ensure that balance, particularly of those who are uninsured, to the extent that the return on investing in their coverage is far greater than if they don't have coverage. And, one of the examples that I like that our state has been exploring under the new administration, under Governor Newsom, is leveraging our purchasing power, I guess, in the space of prescription medicines. And just exploring those ways of how do you negotiate greater value and benefit for your 38, 39, 40 million people. And, exploring that to the extent that, the federal government kind of figures out ultimately what's going to be done, how can we, like in Massachusetts or other states that have kind of undertaken the challenge around providing universal coverage, how can we model that and how can we do it? But ideally, we would ultimately have a federal solution that's complementary to what we're doing in the state, that would allow for universal coverage that is affordable, that is accessible. And then to balance that out, we also have to ensure that we're curating an ecosystem where people live, learn, work, play, and pray that is conducive to, okay, now you have care coverage. We discharge you from a hospital. We send you home with your medication. You come in for your checkup in the outpatient setting. But where are we sending people back to? Are we sending them to healthy homes? Are we sending them to, healthy parks and safe parks for their kids to play in? Are we sending them back to a food oasis versus a food desert? Because if we're sending them back to a place that is not conducive to that, it's just going to repeat this broken cycle that is very costly, and we can't sustain that. It's not affordable. So those are just some of my additional ideas on that question.
Thank you, Jamal. I often say that, health really happens outside the four walls of the clinic or any healthcare facility. And you're absolutely right, because, patients, we may see our doctor once or twice a year, but what we do every day really makes a difference and impacts our health and the quality of that health, and also where we live. And so I'm curious about whether you talked, Jamal, about civic engagement, and I think Dr. Kyle, you kind of touched upon this, but are you seeing any evidence in your comings and goings around, the connection between public health and what like city planning departments are doing to really address the social determinants of health and create healthier environments and build healthier communities. Are you seeing any of that anywhere, either in California or maybe some of the other places that you travel to or aware of across the country?
I can kickstart on that question. I reflect back to my Office of Health Equity days, even prior to my arrival, and since I've gone, the Health and All Policies team that we had as part of our Office of Health Equity did extensive work and continues to do so to this day across 25 different departments, offices, and agencies that focus on how do you get these particularly non-medicine, non-health oriented departments, offices, and agencies to think about the downstream impacts of their programs, policies, and decisions. So whether it's Caltrans, who's a member, Food and Ag, Natural Resources, Department of Corrections and Rehabilitation, thinking about, okay, if you're procuring contracts for those who are incarcerated for food that's high fat, high starch, high sugar, high salt, what does that do to, you know, this controlled population as far as healthcare costs and quality of life go? Does that create a greater public health risk and cost for us? So I use Health and All Policies as an example because Health and All Policies started to work extensively with different cities and counties. So there are 3 health departments that are cities in the state, Berkeley, I think Long Beach, and the others, Pasadena. And they worked a lot with other progressive counties like Alameda County and San Diego and others, LA County, who are starting to put in more progressive practices that focus more on upstream and prevention. And how do you address, you know, the mental health issue, for instance, in LA County within, you know, the local jail system? You know, how do you address it from a more social services facet and integrating public health interventions that we've seen implemented around the world and even across the country in some of the more innovative counties and cities, and maybe in a couple of instances, states. So we were directly engaged in those efforts. I think that needs to be far more the norm than the exception, but it's doable. And in the state, the work continues to some extent, but it still has a long way to go for it to just become a normal practice.
Right. Dr. Kyle, any thoughts on that?
Well, I've been watching how the healthcare industry and the food industry actually have been combining some efforts, looking at food as medicine. And we've discovered that, especially in diabetics, if you actually provide food because of food insecurity, that actually the overall cost for their long-term care goes down. When people eat better, they actually do better. And so there are Geisinger and some other national health chains have actually been trying to use prescribed food, a certain number of meals. And when you feed the diabetic, you have to feed everybody else in the household because you can't have them trying to cook 2 different kind of cuisines. It actually does work, and they got return on investment from that. So I think we're learning about how to invest in our communities rather than how to just take from them. And I think the more we can invest in things that we know are proven to be of help, the better off we're going to be in the long run.
Yeah, we see a great example of that in Oakland and Alameda County. So the chief medical officer for Alameda County, Dr. Stephen Chen, has created a program called All In, which is based on food as medicine. So folks in the community who need it gets access to healthy, fresh produce. And I think Roots Community Health Center is doing a similar thing for some of their patients and clients as well. So recognizing that when we talk about, chronic diseases, most of those, as you guys know, are things that we can control or they are preventable. And so if it's nutrition, physical activity, and lifestyle, those 3 factors really do have a bearing on whether or not we develop those types of diseases and can prevent those diseases from occurring. So I do have a question in the chat box, and if other people have questions, please actually put them in the Q&A box. So I have a question and a comment from Sonia Adam. So thank you, Sonia, for being here today. And she says, I support Dr. Kyle's advice that we have to become more self-sufficient. I would love to hear any of the speakers address the possibilities of existing healthcare systems, integrating CDEP's community-defined evidence practices as a gap filler while communities continue to be under-resourced and underserved. Who wants to tackle that question?
Well, I'll start.
Yes.
I think the answer to that is yes, absolutely. When I was at Loma Linda in the School of Public Health there, we were really looking at community-based, evidence-based practice. I think the community has answers that if we can combine with community efforts around solid data collection and working together, we can move the needle much further down the road than we can. I think the whole idea of the town and gown dichotomy has to be thrown away. All of the knowledge and answers are not found in the academic circles or found in healthcare administrations. They're found in the collaboration with people who are actually suffering and people who are actually experiencing disparities. And I think the closer we work with them, the more novel solutions that we'll come up with. And some of those solutions are as plain as the nose on your face, only if your face is in the right spot. And so if you're too far removed, you're going to dismiss it. And so I think the answer to the question is absolutely that can happen, and I think is happening.
Yeah, great. And so I have a question for maybe Dr. Yerger, you can take this one. So you talked a lot about stress and cortisol levels. And I think that when we all go to the doctor for an annual checkup or to get checked, that is one thing that is not part of the normal screening process, but is a huge indicator for what you may be predisposed to or what may happen as a result of high cortisol levels. So can you, as a naturopathic doctor especially, can you talk about ways that we can cope with stress that may obviously not require a prescription or a visit to the doctor, but things that we can do that we have power and control over doing to minimize the stress we deal with every day?
Yeah, I'd love to. So one of the things that has to happen is education. And I know that's not going to happen in the doctor's office because there isn't enough time to be able to do that. If that's one of the things that distinguishes naturopathic doctors from allopathic doctors is that if you come and you see us for the first time, depending on how acute your issue is, we're going to eventually spend an hour, maybe even an hour and a half with you with education. So, so definitely we need to have opportunities to educate people, especially our community. One of the things that I find very helpful when talking about cortisol is to talk about what happens to the body when you're in the fight-flight response. Many of us understand and appreciate that when we get stressed, what do? We eat. But the whole digestive system shuts down when we're under stress because it's not considered as an essential system. So your body, when you're under stress, is really geared towards getting you out of a stressful situation. So that means pumping blood to your extremities so that you can use your fists or use your feet to get out of a potentially harmful situation. So it shuts down on digestion. So if you're eating during that time and you have issues with digestion, you very often develop symptoms that eventually become related to autoimmune disorders because you're creating molecules that don't get digested, and they're going to get dealt with by the body in some sort of way. So being able to really understand how important it is to get the body in a place of rest. I mentioned earlier about digestion being linked to meditating and being in a place of prayer. That was actually something that my colleague Carol Magruder and I did when we were working with predominantly low-income smokers in the LA area. We incorporated it into one of our cessation curriculums so that we could show predominantly men how it is to just rest and relax. And they got so much out of the visualization at pieces, because breathing is important. And especially for smokers, I mean, they're doing one thing, they're breathing, they're taking time off. So you're no longer smoking. You still need to have opportunities where you go and have breaks and you go and you do your deep breathing. And I don't want to really talk how important it is, breathing is, but breathing does wonders for getting us out of what is called the sympathetic nervous system response into the parasympathetic one. And just really not only talking about this with our patients and clients, but actually taking the time to show them how to do it and to have things set up as reminders for them. Because we know when we get stressed out, for me, I do it a lot quicker because I've been working on this longer. My children do it a lot quicker because they get tired of me pointing it out to them when they're in that stress mode. And I'm not going to talk to you because you're not listening to me. You're unreasonable. So we can find ways to work with each other to help each other know when, let's just slow it down a little bit. Let's just take a few deep breaths, and it does absolute wonders. It doesn't require us to spend any money. It doesn't require us to go down and have to be in a gym. All those things would be helpful, but in the moment to help us in those times, those are some of the, I think, easiest ways of being able to provide some relief.
Yeah, you're right. So conscious breathing, maybe just 5 or 10 minutes out of the day can make a big difference.
And you might need it more than that.
More than that. Right. And so I just wanted to, for a point of clarification. So for those on the video or webinar who may not know exactly what a naturopathic doctor is, or the difference between allopathic versus naturopathic, can you shed some light and explain the difference?
So naturopathically, we're trained to appreciate the body is going to respond to a certain insult, and you want to identify what the insult is. Versus you have a headache, for example, you take, maybe you take a Tylenol or you take something to relieve the symptom. Naturopathically, we're going to want to, help you get there and get some relief, but we're going to dig a little deeper. Why are you getting the headache? Are you getting the headache because you have tension in the back of your neck muscles that need some help? Are you getting a headache because you're dehydrated? Are you getting a headache because of other issues that are going on? So we try to really identify the cause and not just provide a relief. I would say that's the basic distinction between allopathic and naturopathic medicine. But working with us is much more comprehensive. It's much more holistic. We not only deal with physical symptoms, but also we go into the emotional, mental realm as well. And that takes time, and it takes building a relationship. And sometimes people don't have that luxury. They need help right away. And allopathic medicine is where they need to go. But in terms of dealing with chronic diseases, we probably can provide a lot of help, especially for those who have not been able to get help dealing with their chronic diseases, given that 80% of what makes us sick is related to stress.
Yeah. Yes. So I totally agree with you. So yeah, and it also, I think, taking care of the whole person is also important. If we're not physically well, then we may not be mentally or emotionally well, and vice versa. So looking at the physical, mental, emotional, as well as spiritual components of well-being and the whole person approach is critical. So I just wanted to be notable of the time. So I don't see any other questions in the Q&A box. So what I'd like to do is move to wrap things up. So I want to give each of you an opportunity to share some final thoughts or leave some pearls of wisdom for the audience before we depart today. So let's start with you, Dr. Yoger.
So for me, I know there's a lot of focus right now because we have this huge election coming up, but we also need to think in terms of what happens after we vote and how is it that we can stay engaged with the whole political process. If you are unfamiliar and you don't know, but you want to get involved with those of us who have been actively doing it and learn and start off, being mentored, if you will. Because once you get into the process, it becomes more familiar to you, and then you get more comfortable. You can start off small by participating at city council meetings. If there's an issue that you care about, you can just go and watch. If you don't know how to submit a public response card, for example, just being there and being guided in that process. I'm someone who had gone from being a clinician to being a researcher, to realizing the research that I was doing had some very strong implications for the work that was happening at the policy level, and got involved providing evidence to help with the policy, and then just got caught up with the likes of Phil Gardner, who's on, I don't know if he's still on, I know that he was on earlier, and Carol Magruder, in learning how to be politically engaged. And now I just don't see any other way. And I notice that those who are watching me, who are around, are also starting to learn their power in the political process. But it makes it so much easier to get involved at the local level, because those are areas too where you are likely to have issues that affect you directly. But it's a great learning opportunity for us as well.
Great. Dr. Kyle, last thoughts?
I would just add that elections have consequences, and we're now living through the consequences of the 2016 election and the 2018 elections. And do we want to continue that for the next 4 years? I think we have to realize that our vote is extremely important. Rather than being depressed, I'm actually more energized today than ever, because there's so much to be energized about. There's so much that needs to be fixed in our country and in our state and in our local communities. And so I believe that we have to have, I agree with Dr. Yerger, we have to have civic engagement, civic involvement. Some of those who are in this panel or on this call need to start thinking about running for local office and getting elected if that's how you feel God is leading you. But I want to just finish off on also giving my amen to prayer. Prayer is how I stabilize myself in the battle. It helps to lower my stress, because I just give it to God. And sometimes I look at the results of things, and I may not be happy with what I see in results, but I say, God, I'm gonna let you have that, because some of this is bigger than any of us.
Right.
In fact, a whole lot of it's bigger than most of us. And it has helped me. It has helped me to be more mindful and more thoughtful and more creative, because I realize that I'm not alone in this battle. And I'm not alone from a metaphysical, spiritual point of view, nor am I alone in terms of our extended family. All of us on this call, we are family. We're part of a group of men and women trying to make a difference in the world. We're not fighting this battle alone. And so I want to thank the California Black Health Network for bringing us back together again to have this conversation. And I'm sure there'll be future conversations that we'll have. But we stand shoulder to shoulder in the fight, and the fight goes on.
Thank you. Yes, it does take a village. Thank you. All right, Jamal, you're up next.
I'll wrap up by saying that we have no health without mental health. And I know we've said that in different ways. We still have, as a society, but especially within our own community, there's still major stigma tied to mental health and mental wellness, depending on how you want to talk about it. But I'm a huge advocate and proponent, personally, of self-care. And, with this pandemic, with the political toxicity, the civil and social unrest, visually seeing, Black men and women, people of color being gunned down in the streets, the trauma of that is real. So a lot of what we're seeing now is just the tip of the iceberg, unfortunately. And I'm totally optimistic. My faith is strong. And, I know that God has us covered. And we also have to be very honest and practical in how we address the reality that what we see now, especially under this current administration, that Stokes division and chaos and confusion, a lot of this is only the tip of the iceberg, because I imagine that if this administration changes, and it's kind of like you may have leased out your apartment to a very bad tenant. So before you lease it out again, you got to go in there and see how much damage was done. And I would imagine that what we see is not the extent of what kind of damage that has been done. So all that to say we need to be prepared and just be very intentional about how trauma uniquely affects us. And we need to, enlist those resources, proactively. We don't wait until, things progress so badly for us, but enlist that as a core part of our well-being, exercising our physical bodies, exercising our faith, getting therapy as needed. And that will do us a great service as a community. And I think to the extent that we can integrate more seamlessly our mental wellness into how we care for our bodies and even our faith, that's one of the best, benefits that we could experience together. So that's my parting word, is to remain optimistic, take up care of ourselves in mind, body, and spirit, and we'll get through this. But we've got to realize that this is a wake-up call, and it hasn't been easy.
Definitely.
And in order for it to get better, we got to be up for the fight, because the opposition is ready. But we can overcome that.
Yes, I always say we need to be beyond woke, right? And recognize that, like to your point, the tip of the iceberg. There's a lot of things, the tip of the iceberg is what we see and hear in the news and the noise every day. But there's a whole lot of stuff below that sea level that are happening that we don't know about, don't recognize, isn't talked about. But certainly our rights, whether it's related to the environment or civil rights, is being unraveled every single day.
Yeah.
So yeah, it's important to really do your own due diligence and know before you go to the polls what and how to vote on certain measures and who to vote for. That can really represent your best interest and our interest as a community. So.
Right.
So I want to thank you guys so much for being here. I really appreciate your time today and your willingness to be part of it, and all the knowledge and wisdom that you shared with us in the audience. So thank you very much for all of that. And so I'd like to let you guys know, if you are interested in connecting with any of the speakers today, you can connect with them on social media, through Twitter, Facebook, LinkedIn. Dr. Val's website is drval.com. So any questions you have about naturopathic medicine, how that works, how you can benefit from that, you can get in touch with her and connect with her on that. And Dr. Kyle is on LinkedIn, not a huge social media presence, but Jamal is the Ebony Genius, and you can find him on Twitter, Facebook, and then also on LinkedIn. Next slide, please. So just two important dates I would like to keep in mind. The first one is November 1st is open enrollment for Cover California. The California Black Health Network is a navigator and enroller. So we are ready and able to have people enrolled in healthcare who need it. If there's anyone on this call, or anyone who needs health insurance, they can call our office. And also, it's no news about November 3rd, so please get out to vote, because your vote does matter and your vote will count in this election. I voted yesterday, so I'm really happy about that, and feel that my vote is counted, and feel really excited about being able to exercise that right without any challenges. Next slide, please. So you can contact the California Black Health Network. Again, you can enroll in Cover California through us by calling 866-761-4167, or email us at info@californiablackhealthnetwork.org, or you can connect with us on social media. I want to thank everyone for joining us today, wherever you are in the state, and I appreciate your support and attendance. And thank you very much. Have a great weekend and a great Thursday. Take care.
All right, thank you again for the invitation. And Jamal, I know that you recommended me for this slot here, so thank you for it.
No
Great
problem.
recommendation. Thank you. All right, take care.
All
Take
right,
care.
y'all. Take care.
Bye-bye.
Bye-bye. Enjoy the rest of your vacation, Dr. Kyle.
It's going to happen any minute now.
Just don't forget to send that bill.
All right, take care.
Bye-bye.